Joining me on the program now, the president of the Nurses Christian Fellowship in New Zealand, Dr. Mark Jones. Kia ora, thanks for your time today.
That's Murray, Andrew.
Firstly, Nurses Christian Fellowship, talk to us about the organisation, some of the things that you do, some of the things you stand for, Mark.
Okay, well, I guess the organisation is exactly what it says on the tin, really. We're a national organisation in Aotearoa, New Zealand, for Christian nurses. So our prime aim is to support Christian nurses in their workplace, helping them live out a Christian life, bring their faith into work, and just as importantly, I guess, Andrew, trying to help those nurses who have yet to find Christ in their lives appreciate what Christ can do and how they can be his hands and feet as they practice as a nurse. That's essentially what we're about.
Now, nurses voted to strike yesterday. Not all nurses are, of course, are part of the union, and well, maybe it gets a bit murky for you guys, actually, as the Nurses Christian Fellowship. Do you take a side? Are you involved with having an opinion on this industrial action? What stance would you take, Mark?
Well, I mean, the stance that we've chosen to take is the stance that we believe patients, consumers, clients would like nurses to take. That is striving to convince people that we need more nurses in the workplace to ensure that conditions are safe and proper, to give people the best possible healthcare that they deserve. And we believe from a Christian perspective, that's the right thing to do.
And some of that, of course, does involve money, because if we're paying less than the Aussies, then it's difficult to keep the staffing levels up. That's even before the hiring freeze that is in place in many parts of the health sector.
Yeah, that's exactly right. If we don't pay, people the right way, the right wage, and I believe there's biblical truth in that as well, they'll wander off and search for where the money is right.
Yeah.
I mean, that is a driver, but it's not the main driver. I would suggest the main driver is ensuring that people are getting decent quality care in well-staffed facilities.
Perhaps it's no surprise that that people of faith are overrepresented in a caring profession such as nurses. A lot of people who work in our hospitals and medical facilities around New Zealand would adhere to a Christian faith. And to be fair, they're not in it for the money. This is part of an outworking of what it means to be a Christian, to be in a caring profession, to come alongside people who are going through difficult places. For a lot of nurses in Aotearoa, New Zealand, faith is a motivator for their professional, perhaps even calling.
I mean, sure it is. I mean, back in the day, I mean, it was called a vocation.
Yeah.
And yeah, most people will know who Florence Nightingale was. Of course, we had great nurse leaders in our own history, but Florence was called to care by the Lord, and nurses generally follow in her footsteps. So this notion that, as you're saying, using our Christian belief systems to act as a social conscience is what we're doing today. So not just actually caring for people as Christians, as people of faith, but actually acting as that barometer to suggest that we can see that the system is not right. And as a Christian, we believe that we have to do something about that.
That does bring a bit of a dilemma, though, when I've been participating in a union, nothing wrong with that, and certainly some of the rights and privileges that we have here in New Zealand as a result of industrial action. But that dilemma of saying, well, if I vote to strike, if I'm not involved in working as a nurse because there's a strike for terms and conditions and pay levels, then am I abandoning my post? Am I failing in some way as a Christian nurse serving my community?
And I can understand that, and that's a real dichotomy. Just as we in Nurses Christian Fellowship appreciate that there are people today who are probably not getting the care that they were looking forward to have yesterday or tomorrow. But really, we believe, Andrew, that it's in the greater good to not do something today or on tomorrow, just to actually make sure that the vast majority of people in the future are going to get the correct care.
Yeah.
So, okay, we could see it as abandoning the post for one shift, but that ensures that those shifts are filled to capacity in the future.
Your members, the members of the Nurses Christian Fellowship, there'll be people with different opinions there. Some will be choosing to jump on the picket lines. And I think there was a group that were assembled around the Prime Minister's office in Botany yesterday with placards and signs. And there'll be more industrial action tomorrow, as I mentioned. Other nurses who are part of Nurses Christian Fellowship will be deciding not to strike. A balance of viewpoints on this one?
There would be, and what we've emphasised is that there are plenty of things that nurses can do tomorrow, and indeed could do yesterday, to support the principle of safe staffing. For example, we always ensure that there are enough nurses on the ward to ensure that the place is safe enough, even within strike action, because that would be counterproductive if we didn't do that.
Yeah.
So nurses can do that also, volunteer to provide those life-sustaining services whilst the rest of their colleagues are on strike, and engaging in administrative tasks and whatever. So it is legitimate to say, I don't want to leave my post, as you put it, but actually act in support of the greater good of safe staffing.
Something which the Nurses Christian Fellowship brings to the fight, which perhaps the unions don't as much, is the area of prayer. Yes, industrial action, but also praying for the situation at the moment. For you and your members at Nurses Christian Fellowship, what are you praying for, and what would you like the Rhema listeners to pray for as well? How can we support you in prayer, Mark?
That's a really good point, and we wouldn't be a Christian organisation if prayer was not at the forefront. So the prayer would be that those people involved in decision making around funding our healthcare system can work with those nurses who are really keen to provide that best possible care. And as Christ would advocate for himself, we shouldn't be in a fight, we shouldn't be in strife, we should be looking for a common solution. That would be our prayer. And then I would ask Rhema listeners to join with that, for finding a common path, a common way, which enables us to give the best quality of care to people in New Zealand.
Certainly a complicated issue, but God specialises in complicated issues, so we'll encourage people to pray, and also perhaps a toot and a wave if you're driving past some picket lines tomorrow. Mark, thank you so much for the work that you do at Nurses Christian Fellowship. Thank you for taking the time to chat with us today.
God bless. Thanks for the opportunity.
Hey, thanks very much for joining us in the Rhema studio. Thanks very much for watching the interview. It's kind of nice to have an audience, actually. And if you did like what you watched, then do give us a like, do give us the thumbs up. And if you'd like to see more interviews like that one, or perhaps even better, subscribe and those interviews will come straight to you. Don't forget to turn on your notifications, and we'll see you in the next one. Cheers.